format. I'm going to moderate my voice here so I'm not blowing you out. But thank you, Marcia, for the kind introduction. And it's such a pleasure to be here. I really appreciate Mr. Briggs and the whole team inviting me to this wonderful event. As you can see, the title of my talk up here, From Policy to Practice, Strengthening Tribal Data and Sovereignty. Oh, sorry, guys. This is a topic that I could talk about for days, and it's a really important one. Referring to Marcia's elephant, I think that early on in the days, everybody was thinking about the clinical impact of research. So they were looking at the front end of the elephant and never really much thinking about a lot of the data stuff. But now that has come to the forefront, it's really a really important topic to have conversations about. Oh no, that's okay. I just don't want it to be too loud for people here. Okay. Also, as we all know, since 2024, it has been a year of change, right? Tremendous change. And I will talk a little bit about that. It's been quite challenging to understand the whole research landscape. But this is where data, I think, really comes to the forefront, and really thinking about how we think about the holistic approach, or how we utilize data, how we store data, how we manage data, but also what is the overall impact and how we can best utilize the data that we have. There's so much data out there currently that's not being utilized, but we're just collecting more and we're collecting more. So it's really an important time for us to start thinking about what are we doing with that data and how can we make it the most beneficial for our communities. Did it go? Oh, there we go. So a definition of, I think it's really important to start off with the fundamentals, right? A policy represents a guiding principle, plan, or a course of action adopted by governments, most importantly, organizations, institutions, to address specific issues and achieve a desired outcome over time. I think what's really important to also think about is what is the most important thing that we have that helps dictate our relationships with governments, and that's our sovereignty. And many of the federal agencies have tribal consultation policies, which is the recognized way, the formal process of having conversations around really important topics. Those topics are deemed to have significant impact on one or more tribal communities. And that's what we should always be thinking about in the back of our mind when we think about data, when we think about research, we should think about anything, is that we have this really important tool in our pockets as sovereign nations that we should be thinking about whenever there is change needed within the system. And I don't think that that's utilized enough. Many times the federal government dictates what goes to consultation when we should be having more of a say about how that goes forward. It's a really important topic, but policies are super important because they dictate an agenda for an administration, for our research community. But I wanted to say too that even though we've experienced so much change over the last year, this is not something that's new to us. Oh, went the wrong way. All right. There we go. So all of the administrations have made significant changes over time that have impacted our community. So I think that because of what we're seeing today, the only thing that we're really challenged with is how rapidly things are changing and how things have not really been communicated about all of these changes that are happening. But within each of the different administrations, there have been significant changes in research that have impacted us. It's just that we were able to plan a little better for those changes, and we saw them coming. These changes that are happening now are sweeping, and they're coming so fast, it's really hard to adjust for them. And the communication around the administration has been so challenging that we really haven't had consistent communication as well. So it's really important to recognize that changes happen across all administrations. It's just that we have to think about how we plan for them and how we prepare for them. So the policy goals are really important. But I think that this is what's most important here, is that data is the single most important driver for policy change. You've heard of data decision-driven changes or data-informed policy changes and adjustments. That's why data is so important for our communities. In order for us to create significant change, people are always want to say, show me the data. And why do we use data? It's because data is supposed to be something that removes the inherent biases of humans when it is applied to policy. But there's a lot of considerations that we have to think about, right? How the data is collected, how it is presented, that also can create bias. So there's a lot of different things, a lot of different rabbit holes that we could go down in terms of data and how it is represented or what it means. But just know that it is the single most important consideration when thinking about policy or creating policy changes. So I think another important thing is that a lot of people are always talking about data, but what is data, right? Data is, according to the Webster's definition, it's factual information, such as measurements, statistics that are used as a bias for reasoning, discussion, or calculation. So how do we get data and where does data come from? Because data comes from all different forms. They collect data on us when we surf the internet, right? There's been a lot of litigation in terms of the data that's been collected to create programs to get people to more interested in surfing certain platforms. You know, like I think Meta was one of the big ones. So data is always being collected, but we have to think about what is data in this regard or in this sense for healthcare. So data is collected, here, every time we go to the clinic, we have to think about this. And you can see here's a schematic from a journal in molecular and biology journal here that you can see that when you first come in the door here, that somebody collects your vital statistics, right? And they write that down, and that is part data. Data is collected all throughout the process of your clinic visit. So what happens to that data? Here's a picture of the Cheyenne River IHS unit. But it's really important that there's so much data being collected around us individually. Where does that go? And it sits in an IHS facility or in a clinic in terms of electronic data. But data that's collected like this can serve many, many different purposes. One of those purposes is through scientific research. And this is something I'm glad she's here. Dr. Mel Nadu, who's in the back there, she worked in collaboration with other researchers to really highlight some of the data that had been collected and reported through electronic health records that really highlighted a real disparity amongst our American Indian lifespan in North Dakota. So data can tell us a lot of different things. Data can tell us, that we are not as healthy as we should be, and I think we all know that. But data, the good thing to know is that how do we use this data to improve our lives? We know this, and I think that's one of the really good things about the current administration is they're really trying to focus on not so much research that's telling us that we're sick and we're not healthy, but what are some of the innovative interventions that are being created and tested in our communities to make sure that we're making some kind of advances in terms of the research that's ongoing. So data, like I mentioned about, it comes in all different forms, but what's really important now, what's a huge concern is the digital data platforms. You can see here that there's electronic health records, you can do all kinds of things on your cell phones now. There are smartwatches that collect how many steps you take, your blood pressure, your heartbeat, all of these different things. There's online healthcare records, there's telehealth, there's mobile health, there's artificial intelligence and machine learning in healthcare, which I'll talk a little bit more about. But there's so much data that's being collected right now that's really important for us to think about how we use that data, but also how it's protected in terms of tribal sovereignty. So one of the things I want to talk about here is something that is really innovative and things that are moving. I still collaborate quite a bit with folks at the NIH, and some of the things that they're doing is they're thinking very carefully about all the data that's being amassed. And one of the directors there, she's really has an attention to how we can use this data to improve health. So transforming the quality, capture, the sharing and use of health data will enable the creation of a well-protected utility for improvement of health, healthcare outcomes, and common interests of individuals and society. So this is really important because we have to think about our tribal communities because we have capacity and infrastructure issues and challenges as it relates to research. We have so much research that's happening that it's not connected and it's not more holistic like Marcia had mentioned before. So there's this really cool and innovative idea or effort that's happening right now that's called data counts. And this is something that I think is really important, is that we're utilizing the data. Remember I had mentioned that when you come into the clinic, your your information is collected. But what is it used for? Well, there are now is artificial intelligence and machine learning models that are being created that are analyzing millions of electronic health records, because each one of us is very unique and very different. But people like us are having similar conditions in other parts of the country. So it's really important for us to think about, if we have some kind of rare disease condition, if we are employing very thoughtfully and very carefully artificial intelligence and machine learning, if we would be better able to diagnose individuals at an earlier stage or at the earliest onset of these conditions, to be able to treat them at the earliest stages to improve their recovery from many of these different disease conditions. I think cancer is something that touches all of our lives and all of our families. This is where a tool or a system like this could be extremely impactful. This is the virtual twin, it's called the digital twin virtual model. And so you see the person here who's more of the solid color, that would be the individual going into the clinic. And once all of their health diagnostics are collected, then that is compared to all of the other health electronic records that have been collected from individuals across the country. And then those who match up most closely would be pulled out and identified. What was their disease condition like? How were they treated? What are some of the things that we need to get to this individual before this disease progresses? So this is the use of artificial intelligence and machine learning that is currently underway and is being devised in many different healthcare settings. And this is something that I think tribal communities should be thinking about, because these are really important advances. As long as we know the ins and outs of how these records work and how they are stored and how they are accessed, it's really important for us. So data, like I had mentioned before, is super important because data informs policy. It also informs behavior. It influences behavior, but it also will change the practice. So data is absolutely paramount to everything that we're doing in research. And that more of a holistic picture is really going to say something about how we're able to improve the health of our communities in the near future. So something that I think is really important that we lose sight of, like I mentioned, there's so much data out there. These are publicly available data sets from the CDC. There's so much data out there, and we are not utilizing the data that is currently available to us. Congress recently required the establishment of our tribal epidemiological centers to have access to all of this data, which they didn't have before. But there's so many different things that come into consideration around data incompatibility, and also who is trained to actually understand and analyze this data is a really important factor as well. So this comes into the fact of who has access to our data, but also who is seeing, reviewing, and analyzing our data is also critically important. So this is, for us, it's really time to think about how we utilize data to our advantage to improve health. And there are so many different technologies that are coming about. And here you can see that individuals up here, there's a yellow and a red person up there. Those are indicative of a huge population. And how do we identify how to best care for these individuals? But also, how do we train our up-and-coming Native American population, our data scientists, to be able to handle this emergence of data and to best utilize the data that we're now amassing on all different fronts. And it's also an important opportunity for us to think about not sharing or restricting our data, but how to use it properly. Many of our communities have heard about data sovereignty, and there are folks out there who are really stressing, you need to restrict the data, you need to keep the data closed, you need to keep it close to your vest and everything else. But doing that really doesn't allow the opportunity for us or others to be able to answer really important questions for our communities. And we have to do this together because I think we've seen that individual communities are only able to make certain advances because we are limited by capacity, we are limited by infrastructure. So it's more important now than ever for us to really come together to think about how we partner with Navajo, with Hopi, with Oglala Sioux, with Cheyenne River, with Turtle Mountain Band of Chippewyans, to make a more unified approach to how we all share data together, how we secure our data, how we train our next generation of American Indian data scientists to be able to analyze our own data and to be able to share this broadly. When I was with the NIH during the COVID period, one of the things I heard most prominently from our tribal leaders was, Dave, we have no idea who's getting sick in our communities. The only way that we know this is when they go into our emergency rooms, and by that time it's too late. And so by having some of these early surveillance systems in place, using data, using artificial intelligence, I think there's a real opportunity for us to have a better handle of all of the emerging and progressing diseases in our community. So I really think that now is the time. There's always been this push for us to exercise our sovereignty because of how we see how fragile the infrastructure is across the federal government and how things can really change to set us back. I would say easily the scientific enterprise has been set back 10 years, at a minimum 10 years, because of all of the changes that have occurred. Who knows what that means in terms of our tribal communities? How do we protect ourselves from other administrative changes in the future? If we don't do this now, this is going to happen again. And then we're all going to be in this situation again, where we're trying to figure out who has the data, can we have access to the data, who's sharing the data, should we be sharing the data? Those conversations we need to have now, because we need to be sharing data, but we need to have full control of the data that is being shared and understand exactly what it's being utilized for. So I wanted to end on, this is data sovereignty, and I have just a little puzzle up here. I don't have a really cool elephant that has all of these different things on here. But data sovereignty is just one piece of this really big puzzle. And it's a really important piece, but not many people have really been focused on it. So it's really the time for discussion amongst many tribes. There are tribes who have had these discussions and who have been very progressive, but I think it's time for others to share what they've learned through this process, because there are policies, there are loopholes, there are interpretations that we should be taking advantage of to secure our data, to make sure that people have access to our data and it's utilized in the right way so that it has the greatest impact. Thinking about programs and how they've been set up by the federal government, there are policies that define these congressionally mandated programs, and we should be looking at those to make sure that they continue to remain, but also how do we improve them? If they want to change these programs, let's change them to the benefit of our communities, not to the detriment of our communities. So there are tremendous opportunities for those of you who are beginning your research careers. Think about a career in policy, because that is where you're going to really understand all of the different nuances that go along with biomedical research, health research, and public health that really need to be changed. You can see the big gaps, they're very apparent, but as a limited population, there's very few of us who are able to address these, and we need you there at the front lines helping us to make these policy changes so that we can make sure that the research is best, the scientific integrity is there, but also the dissemination and the findings are getting out to the community and serving what they were intended to do, was to improve the health of our communities. So with that, I want to say thank you very much for your time, and I'm happy to, if there are any questions, take a. Is that